Hello, everyone on YouTube Live, on Instagram Live. Just going to adjust the feed here, and on Twitter Live. This is the first time we've been live on Twitter. Welcome to everyone on Twitter. We'll be talking about neck exercises, in particular, how you can strengthen your neck in this video. So thanks for joining us today. This is part of our series of self-improvement in 100 days. And we're on day number 4. And some of these days we're going to be talking about what you can do physically to get in better shape. We're going to be talking about nutrition. We're going to be talking about lifestyle. We're going to be talking about what you can expect by going to the chiropractor. So there's a number of things we're going to talk about during this 100 days. Ultimately, our goal is we want to see you healthier on day 100 than when you started this journey, or right now on day number 4. So please join us. We'll be live on a daily basis, or most days, I should say. And today we're talking about strengthening. If you have any questions, type in the comments on Instagram or in the chat on YouTube. I'm sorry, with Twitter, I can't take any comments because the camera is only one way, actually. If anybody knows how to turn the camera around, flip it around on Twitter for the live feed, please type in the comments on Twitter. So let's get right into it. And so today we're going to be talking about strengthening. We're going to be talking about movement. We're going to be talking about how to do these movements, how many repetitions and sets to strengthen your neck, when to do them, and how you might feel doing these. And just a disclaimer before we continue, it's best to check with your health professional about these exercises, because these are level 2 exercises. They're level 1 is just getting more flexibility in the spine. But once we see the patient improving with our care in the clinic, and they are doing some stretches for their spine, and usually I give them yoga type of stretches, and we went over that yesterday. We talked about cat and dog and the wide child as far as stretches for the spine. And these are yoga type of postures. And today we're talking about strengthening, but you have to check with your health professional first before you do these exercises, because every person's spine is different. So we want to talk about the cardinal movements, and I'm just going to get my picture off the screen here. And we're going to focus in on these cardinal movements. So in the neck, the cardinal movements are flexion, extension, rotation, and lateral flexion. In this graphic, they put in hyperextension. Just ignore that one. So today we're talking about flexion, extension, rotation, and lateral flexion. And if you're on Instagram or Twitter, I'll put a link in the show notes so you can easily go to this, or you can go to the link in our menu, Linktree, and you can go to YouTube, and you'll be able to watch this video with the graphics after. So again, the 4 cardinal movements: flexion, extension, rotation, and lateral flexion. Now for rotation and lateral flexion, we're going to be doing exercises both to the left and the right. So there's going to be a total of these 4 movements, but for rotation and lateral flexion, you're going to do exercises to the left and to the right. So you're going to have 6 total exercises to do. Okay. So I'm going to switch back here, and you can see my graphic. These are the movements that I'm going to go over. And we have a new puppy, and Luca is jumping up here. He's pretty excited to see me doing these exercises, and I set the self timer to be able to show you how to do these. So here I'm doing flexion. So you want to have your shoulders on the end of your bed, or I'm lying on a chiropractic table. And then what you want to do is just pick up your chin to your chest. So really what you want to do is just focus on tucking the chin into the chest. I turned for the camera here and for the dog that was jumping up on me, but you just want to focus on chin to chest. Just keep it a simple movement going up that way, and try to keep the shoulders on the table. So just keep your body flat on the table, just flex the neck, and try to get your chin down to your sternum, the chest area. Okay, that's the first movement, and that's called flexion. The second movement is extension. This is a little bit harder, especially if you've got some neck issues. If you have a sprain or strain of your neck, you have irritation of the joints, what we call a facet syndrome, this might be harder on you. So for this one, you just want to lie flat on the bed or table and then have your head extending off, and then pick up your eyes to look parallel to the floor. So try to get your chin up as high as you can, and then let it go back down. And then the chin up as high as you can, let it go back down. So this is extension. This could be a little bit more challenging for you because extension generally works the joints harder than flexion does, except in disc type of disc conditions where we find flexion sometimes is more difficult. The next one is lateral bending. Here I'm lying on the table on the side. You don't really need a table or a bed for this, but if you're lying horizontally, it helps because when you go against gravity, it's going to strengthen the muscles. So you're just tipping your ear to the shoulder as high as you can against gravity. Here I'm doing right lateral flexion, and then you want to flip over and do left lateral flexion. So make sure you do both sides when you're doing this exercise. And then finally, rotation. Rotation, you can do it face up or face down. Face down's a little harder, and on this graphic, I'm face down, and then I'm just turning my head to look 90 degrees. You might not be able to get 90 degrees, but go as far as you can without hurting yourself, and do that both ways. Here I'm turning the other way, and you can see Luca's back at it, trying to do these exercises with me, or maybe he just wants to play. I'm going to come back on the screen here and just go over some other tips for you. Okay, so some other tips that I have on doing these exercises are building strength in these muscles takes time. So it's going to take days or weeks for you to build up the strength, depending on how long you've had the problem for. You should have already started or completed level 1, which is flexibility. Those are yoga type of stretches, cat, dog, wide child, that we went over yesterday on day 3 out of day 10. Day 3 out of day 100. Do 10 repetitions of this exercise of each one of these. So 10 repetitions of flexion, 10 repetitions of extension, 10 rotations to the left, 10 to the right, and 10 lateral bending to the left and 10 lateral bending to the right. Do 3 sets of these. So that's 30. I would take just a couple second break in between. And depending on how you want to do these, you could do 3 sets of flexion all at once, or you could do the whole rotation of all of these exercises and then go back and start again and do three sets of that. So that's 2 different ways to do that. Do it first thing in the morning. And I would get out of bed. I would, get well hydrated, drink some water. I like taking some electrolytes first thing in the morning. We can talk about that another time, but I'll drop a noon electrolyte tablet in my water, or I use magnesium just to get the body hydrated and get the right ions back in the body, and then get into your exercises. The other time you can do this is before bed. And I would suggest doing these exercises first thing in the morning, and if you're getting good at that, then add a bedtime routine just before bed, so you're doing them twice a day. Total 6 exercises. Stop if you have pain, so let your doctor or your therapist know if you have pain, and they will reassess your condition with you. If there's muscle soreness, this is normal, just the muscles working. Sometimes you'll get some lactic acids building up, and the next day you'll be a little tender or sore. That's okay. And I'm just going to review where we're located. My name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia. I've been practicing for over 25 years. If you need any help, DM me, or you can comment, depending if you're on YouTube, Twitter, or Instagram today. I'll put a link in the show notes so you can book an appointment. You could also scan with your camera this QR code, which will take you to the link to book an appointment. So feel free to do that. And then follow us on social media. We're at Dr. Cary Yurkiw, and we're on YouTube at the same handle. And I encourage you to like our posts, comment on our posts, and then subscribe to our channels because it helps us to reach more people. So please do that. And my podcast is called Super Healthy. It's on Apple and Android. You can also get it on Spotify as it's distributed to those networks. So we're on all those channels. Subscribe to that as well, because when a new episode is available, you're going to get a notification of that. And generally, we'll get the podcast uploaded later today or tomorrow. So it's within 24 hours, you'll get a podcast notification. And then on YouTube, you're going to get a notification as well that we're live. So thanks for joining me today. I really appreciate it. I hope you enjoyed this webinar today on strengthening the neck. And please subscribe, because there'll be many, many more webinars coming up in the days to come.